So here we are looking at the dissection of the neck region. This is the inferior angle of the mandible. At this level, we have the another important surface landmark, the thyroid bone. Here you can see the thyroid cartilages, lamina of both sides meet at the highest point, which is known as the Adam's apple. This is a male cadaver, hence it is much more prominent. Now here we have the upper border of the manubrium of the sternum. This is the clavicle. So on both sides the clavicle, posteriorly we have the spine of the C7 vertebra. So this is the extent of the neck region. From this inferior border of mandible, external acoustic meatus, the superior nuchal lines, external occipital protuberance. So the most important surface landmark is this muscle, that is the sternocleidomastoid. As you can see, it has two heads, the sternal head and the clavicular head. And together they go and insert onto the mastoid process, hence the sternocleidomastoid. Now this muscle, it divides the neck into two regions. Now if we take this as the midline, then the neck region, if we see from lateral aspect, it is a quadrilateral region. Now this muscle divides it into the anterior triangle and the posterior triangle. The posterior border is this muscle, which is the trapezius. So this is the posterior border of the posterior triangle, trapezius. So based on this sternocleidomastoid, we are dividing the neck region into the anterior triangle and the posterior triangle. Now the boundaries of the anterior triangle will be the midline, the base of the mandible, external acoustic meatus and the mastoid process. And here we have the anterior border of the sternocleidomastoid. Now further, this anterior triangle has been divided based upon this hyoid bone into the suprahyoid region and the infrahyoid region. In the suprahyoid region, you can see these two muscles. These are the anterior belly of the digastric. So in between this anterior belly of the digastric and the hyoid bone, we have the submental triangle. Below, the floor is formed by the mylohyoid muscle, and in midline is the midline mylohyoid raphe. Now coming to the next triangle of the suprahyoid region, this is the digastric triangle. You can see this is the anterior belly of the digastric. This is the anterior belly of the digastric. Here you can see the posterior belly of digastric, the inferior border of the mandible. Here we have the external acoustic meatus, and posteriorly it extends till the insertion of this posterior belly. So we have only cleaned the anterior part of this digastric triangle. Here you can see its content, that is the submandibular salivary gland. Along with it, you can see the large number of lymph nodes present. These are the submandibular lymph nodes. Now as I reflect this submandibular gland, you can see this nerve which moves deep to the mylohyoid. This is the hypoglossal nerve. There are some other structures which are present on the posterior aspect, such as the external carotid artery and the branches. Okay, now coming to the infrahyoid triangles. If we consider the midline as one of the borders, here we have the lower part of the sternocleidomastoid, and here we have the superior belly of the omohyoid. So this is the muscular triangle, and contents are the strap muscles, the infrahyoid muscle. This is the sternohyoid. Here we have the sternothyroid, and below we have the thyrohyoid muscle. So all these muscles along with are the contents of the muscular triangle. Now coming to the next important triangle, that is the carotid triangle. Now if you look at this, this is the posterior belly of the digastric. Here you have the superior belly of omohyoid, and here you have the anterior border of the sternocleidomastoid. So in between this you have the carotid triangle. Now what are the contents of this carotid triangle? You can see the common carotid artery. Here it is the carotid sinus. Now the common carotid is bifurcating at the level of the upper border of this cartilage, lamina of the cartilage of the thyroid cartilage. So here it is dividing into the internal and external carotid artery. Other contents, here you can see the internal jugular vein. Within that you can see the vagus nerve. Now the carotid sheath has been removed, so along with it the ansa cervicalis has also been removed. Coming to the posterior triangle. So the posterior triangle borders, you can see this is the sternocleidomastoid. These are the fibers of the trapezius. So posterior border of the sternocleidomastoid, anterior border of the trapezius, the middle third of the clavicle. Together, they are forming the boundaries of this posterior triangle. Now this posterior triangle is further subdivided into two smaller triangles. By this is the inferior belly of the omohyoid. So below this is the supraclavicular triangle. Above it is the occipital triangle. So coming to the supraclavicular triangle, what are the contents? Here you can see these are some supraclavicular lymph nodes. This blood vessel, you can see this is the transverse cervical artery. Behind the clavicle, you can see the subclavian vessels, that is subclavian vein, and behind that we have the subclavian artery. So here you can see this is the subclavian vein. Then coming to the occipital triangle. In the occipital triangle, you will find this is the spinal accessory nerve. You can see coming from the posterior border of the sternocleidomastoid and also piercing the trapezius muscle. Now if we move above, we can also find the occipital artery and its branches. So here you can see a small part and it needs to be dissected further. So here you can see the inferior border of the mandible. Here it is the angle of the mandible. Posterior to that you have the external acoustic meat. In between this angle of the mandible and the mastoid process, you have this large gland. You can see this is the parotid gland present in the parotid region. This is the parotid gland present in the parotid region. Posterior to that we have the mastoid process, and behind that, that is the external occipital protuberance and the superior nuchal lines. So below that you have the region of the neck, and it extends up to these borders, that is up to the clavicle, first rib, the sternum, and posteriorly you have the T8 vertebra. They continue to form the root of the neck. So inferior to the mandible, inferior border of the mandible, you can see this region of the neck. Here another important landmark is the hyoid bone. So based on this part is known as the suprahyoid region. Below the hyoid bone, it is the infrahyoid region. You can see this is the anterior belly of the digastric, the posterior belly of the digastric. This is the inferior border of the mandible, the external acoustic meatus. Behind you have the mastoid process. So together they are forming the boundaries of the digastric triangle. So in this anterior aspect of the digastric triangle, you can see this is the submandibular gland. Beneath the submandibular gland, you can find this nerve. This is nothing but the 12th cranial nerve, that is the hypoglossal nerve. Here you can see some superficial submandibular lymph nodes. These structures, they are the submandibular lymph nodes. Then look at this tortuous blood vessel. This is nothing but the facial artery. Alongside that, you can also see the cut end of another collapsed blood vessel. This is the facial vein. So this structure, this is the facial vein. So these are some of the contents of the digastric triangle which we can see. Now moving down, these were the two suprahyoid triangles, that is the submental and the digastric triangle. Now coming to the infrahyoid triangles, midline. This is the anterior border of the sternocleidomastoid. This is the superior belly of the omohyoid. So this structure below this hyoid, you can see the midline, the anterior border of the sternocleidomastoid, the superior belly of the omohyoid. Together they are forming this triangle known as the muscular triangle. Now this muscular triangle, it is known as the muscular triangle because its contents are mainly the strap muscles. This long muscle you can see from the originating from the sternum, going all the way up to the hyoid bone. So this is the sternohyoid. So this muscle is the superficial and medial most of the. This is the superficial and medial most of the strap muscles. and inferior and deep and lateral to it is the next muscle, that is the sternothyroid. So here you can see this is the sternothyroid, the sternothyroid. Apart from that, you can see this is the superior belly of omohyoid, infrahead, another infrahead strap muscle. Here you can see this is the inferior belly. This is the inferior belly. It is more clear here. This is the inferior belly. So superior belly of omohyoid, the inferior belly of omohyoid muscle. So this triangle is the muscular. So the strap muscle, sternohyoid, thyroid, sternothyroid, thyroid, and the omohyoid. Okay. Now moving to the next important triangle of the neck, that is the carotid triangle. Now students, what are the boundaries of this carotid triangle? Here you can see the posterior belly of digastric. This is the superior belly of omohyoid. And here you can see this is the anterior border of the upper end of the sternocleidomastoid. So this triangular region in between, this is the carotid triangle. Now why it is known so? Because if I reflect this sternocleidomastoid, you can see there are some important neurovascular structures. So these neurovascular structures, they were originally covered by a sheath known as the carotid sheath. So after removing the carotid sheath, we can see the contents. That is, this is the large common carotid artery. This collapsed blood vessel, this is the internal jugular vein. In between these two, you can see the nerve, that is the vagus nerve. So the three main contents: common carotid artery, the vagus nerve, the internal jugular vein. These are the major contents. And as you can see, this common carotid, as it reaches the level of the upper border of the lamina of the thyroid. So here you have the thyroid cartilage. You can see, if I reflect the strap muscles, you can clearly see the thyroid cartilage. So this is the lamina of the thyroid cartilage, and this is the level of its upper border. So if I look at this level, you can see the bifurcation of the common carotid is taking place. This common carotid, it is bifurcating into external and the internal carotid. So this external carotid, as soon as it arises, it gives off a branch. This is the first branch of the external carotid artery. So this is the superior thyroid artery. Now if you trace this superior thyroid artery, you will reach to the apex of a gland, that is the thyroid gland. See, if I reflect this, I have reflected the sternohyoid, I have cut open the sternothyroid. So below that you can see this is one of the lateral lobes of the thyroid gland. So we have to dissect open the false capsule. So before opening this false capsule, let us see few more relations. You can see this superior thyroid artery, it is reaching till the apex. Here it again divides into two divisions. One is going posteriorly, the posterior division, the anterior division, and the posterior division. You can clearly see here the anterior division running along this anterior border of this thyroid gland. And here you can see it is coming down, giving a midline branch also, that is the superior thyroid artery. And students, we all know that in relation with the superior thyroid artery, we have the superior laryngeal nerve, which is nothing but the branch from the vagus nerve. So it is related to the artery in the upper part. So here you can see this is the superior laryngeal nerve. Now if we look near the gland, the artery is all alone, whereas away from the gland, it is accompanied by this nerve. So if we are doing a thyroidectomy, we need to ligate the artery close to the gland. If we do it slightly above, then we might involve the superior laryngeal nerve, which will again paralyze the muscles of the larynx. In the inferior lobe, if we see, the blood supply is by the inferior thyroid artery. This inferior thyroid artery, it is a branch from the thyrocervical trunk, which is itself coming from the first part of the subclavian artery. Accompanying it, you can see a nerve, that is the recurrent laryngeal nerve. This is a branch from the vagus nerve. So these are associated to the lower pole of the thyroid gland. And you can see these two structures, they are very close to each other, nearer to the gland. So if thyroidectomy is done, you need to ligate these two structures away from the gland. You need to ligate the artery away from the gland so that you can spare the nerve. So in the upper lobe, you had seen the artery, the superior thyroid artery and the superior laryngeal nerve. They are in close proximity away from the gland. Nearer to the gland, they are separate. So you need to ligate the superior thyroid artery nearer to the gland, whereas the inferior thyroid artery you should ligate away from the gland.